We are here today to launch the Evidence to Policy program. The Evidence to Policy program is a program that is looking at finalization of the national care policy and socialization of the same within communities in Kenya. The government of Kenya has within its Vision 2030 and within its Women Economic Empowerment policy and strategy a desire to develop a national care policy, a policy that is looking at child care, it is looking at elder care, it is looking at persons with disability, and it is also looking at those who have long-term illnesses. So concerns around infrastructure for care, especially for children who are below 4 years of age, certain technologies around water systems, for instance, and the length of time that women spend collecting water or collecting firewood. So a study was done way back in 2021 by the government of Kenya, supported by the UN Women and Kenya National Bureau of Statistics, funded by the Bill Gates Foundation, looking at the amount of time that people, women and men, girls and boys spend on unpaid care work. And the findings were that women spend 3 times more time on unpaid care and domestic work. And yet this work is crucial, but it does not contribute, it's not valued, and it doesn't contribute to the GDP of this country. So for economic development, it is important that women are part of that process, that the unpaid care work that they do is recognized and it contributes to the GDP.
We have seen a lot of positive outcomes, particularly around increase in women's agency to start and run productive activities, businesses. They are able to get into groups to save and also to continue in that trajectory out of extreme poverty. But also we have seen that they have time poverty. When we talk about poverty in terms of income, sometimes we forget about time poverty, and we have realized that some of the barriers to women engaging in productive economic activities have been time, and particularly the unpaid care work.
The policy that we've launched today addresses issues on empowering women, upgrading the poor as well. So this policy, as the partners have talked about, will be able to talk about that woman who does a lot, but yet you cannot quantify or rather make it to appear in the country's GDP. So empowering women to take care of themselves has also made them take their children back to school and discourage issues FGM and early marriages.